It's Wednesday, the 19th day of August. Let's move quickly to the Port Authority of Guam, where we have the General Manager, Rory Respicio, standing by. Obviously, Rory, good morning. Well, first of all,
I was just waving hello.
Good morning, Chris and Bree.
right, good morning.
Good morning.
I guess we'll just give the floor. Tell us the situation. So you have a COVID-19 positive case, and then I had heard something about 50 others who may have had some type of exposure. So go ahead, Rory.
Yeah, well, about 4:30 yesterday afternoon, I received confirmation that a port employee was COVID positive. This employee's last time they were on the port was Thursday afternoon. They started feeling a little sick. And then when this employee felt sick Friday morning, the employee didn't come to work, decided to take the test. And so 2 days ago, the employee took the test, and yesterday they were confirmed positive. So this is just an example of the employees here knowing what the protocol is for a critical infrastructure worker, for as long as they remain asymptomatic, for as long as they're not positive, and although they may have been potentially exposed, they still come to work because the operation must go on. So what we're doing in this case, the employee, because they're positive, they're staying home. I'm in constant communication with this employee. This employee is currently experiencing mild symptoms, but as we know, even from the governor's account, every day is a new day, right? And so this other incident with the 59 other port employees that were potentially exposed, this had to do with us issuing vouchers for them to go and get their PPEs. And so an employee of that particular private sector place tested positive for COVID-19. So we looked at all the employees that remitted their voucher during that time period. We're kind of helping public health, as public health has been helping us stand up the port clinic. We're doing our own contact tracing in coordination with public health. So through that vendor and through our own safety office and human resources office, we've identified 59 port employees that may have potentially been exposed. But none of them, I want to say, are symptomatic. We had a case of one employee who at the time was feeling a little ill, but they're no longer feeling ill, and I believe that that employee is back to work. But I want to thank Acting Director Arthur San Agustin for confirming that these 59 employees will get tested Thursday. And for those that were exposed to this recent COVID-19 positive, they would be tested on Friday.
How many?
And so we're doing, go ahead.
I was going to say,
Sorry.
how many employees have you guys identified as close contact to the one positive unrelated to the 59?
So this employee, first of all, I asked if this employee was part of the 59, and I was told this employee was not. So then for this most recent exposure, I want to say probably no more than 20, because this employee is confined to a particular division. But as soon as I was told 4:30 yesterday afternoon, I was already told that the area was disinfected. Again, we just don't stop our operations. We make sure that the employees are secure. They know the protocol, they know the drill. And we have this pandemic influenza plan that we're following that gives us the CDC guidelines that are all in conjunction with what Governor Lou's been telling us to follow early on.
Can you just clear up the 59? Are they at work or are they on leave?
They're still at work because they're not symptomatic.
Okay, and then the 20, they're also
know.
still at work.
Correct.
Okay.
But they are. And because you can imagine if 60 employees had to secure, I need the employees to still move the cargo. We're not set up to telework. There's no employee that can move cargo from their houses. And this is why, we have a really strong communication with our employees, with our deputy general managers. Our board's very supportive. Communication is very important for our employees. We kind of have, every time the Joint Information Center puts out the public health guidelines on what to do if you're exposed, how you have to, quarantine, we have to tell them we're not following that because that's not what we follow for a critical infrastructure employee. And so that's why we have the public health clinic here. We had almost 22,000 visits since we opened up. We're just telling everybody to act as if though they've been positive, act as if though they're talking to people who have been positive, and just take all the necessary precautions.
Rory, so I know you had talked and said that the 58 are still on the
59.
job. 59 are
59.
still on the job because you can't operate the port without those 59 employees. But what if one of those is asymptomatic and infects other employees? What kind of protocols are in place should you have to sideline, 10, 15, however many COVID-19 positives, and how would it affect the port operations?
Yeah, so we've also run very many different scenarios since March. We even tried to scale down to 1/3 of the workforce. But if we're required to be 100% operational, we discussed this earlier, right? It's very difficult to have 1/3 the staff and to still be able to move the cargo. It's very difficult to have a entire division not come to work because of the population requirements here, because every division is important. But what we have been doing is taking these precautionary measures since February, telling the port employees they can't have any interaction with the vessel crew. There's the protocol that's in place. If a vessel crew member is sick, within 2 hours of them entering the port, they have to notify the Coast Guard. Coast Guard notifies the harbor master. Harbor master calls public health. And so those things have been in place. I mean, I just think about every day. Maybe the better thing to do would be to just isolate people, even if they believe they're exposed, and that's really what should be done. If they're not involved in a kind of operation that requires them to be there, so that we don't disrupt the supply chain.
Right.
But we have hand washing stations. We have 9 throughout the port. We have hand sanitizer stations all over the place. We are looking at the social distancing. We have the guards. You call it the plexiglasses. We tell the employees don't socialize. Even when they go out for a smoke break, they're doing the 6 feet apart. I also want to say that I appreciate the port employees who have to wear the mask out in the hot yard. They're saying it's very difficult, it's convenient, but even at that, they're just really, really, really doing what they can to make sure that the port has this COVID-free environment.
Aside from the one that was identified yesterday, has anyone else tested positive at the Port Authority?
Very, very early on, we had a case of a COVID positive, and so the same protocol applied. So remember, once they're confirmed positive, they stay home, they secure. Once they're symptomatic, even if they have the flu, their nose is running, or they have a slight itch in the throat, they just stay home. So we don't force the employees to. We don't tell them come to work even if you're sick. That's the difference. Once they're having some kind of sickness, even if it's the flu, whether they've been exposed to COVID or not, they're required to stay home. And so the check and balance here is every morning the division heads report to me which employees are out, and then which employees are out because of annual leave or sick leave, or they may have been in quarantine, because we did have some employees who went to the States, and on their way back, they have to go through that quarantine protocol, which we don't do anything about that. We have to observe those processes.
Right.
But can you imagine if I just tell people, if you believe you've been exposed, just stay home, and then one day I have 60 people not calling in for work?
Right.
So how's that employees back to work?
No, yeah. The first
Yeah.
situation, that's way past that.
Right.
But again, there's no employee that's positive that's still coming to work. There's no employee that's sick that's still coming to work. But this employee that just recently tested positive, I'm in constant communication with this employee, checking on the employee, and the symptoms are mild. But we're going to be monitoring this every single day. And the 59 employees with potential exposure, we also reached out to our port clinic nurses to have them in constant contact. And they know every day to check in with the port clinic. And of the 22 port visits, we have yet to have any fever or any symptoms of COVID-19.
So they're going to go get tested, the 59 on Thursday, probably like on a specific schedule so as not to hamper the operations at the port, right? Okay.
Yeah, correct. So we're going to stagger them. And Dr. Kaneshiro, I spoke to her yesterday. Again, thanks to Arthur San Augustine. And I want to also say that Janela Carrera and Krista Paco with the Joint Information Center have been very helpful so that we're going to coordinate our responses and to reassure the public that the port is taking every precautionary measures necessary to make sure that we're operational, but that we don't jeopardize the health and safety of our folks here.
All right, Rory.
Okay.
Thanks.
Thank
Thank
you. Thanks
you.
for zooming with
Stay
us.
safe.
Yeah, wash your hands.
Yeah,
Wash
there
your
we
pep.
are, and all the time. Thank you.
Okay, Rory.
Stay safe.
You too. There you go. 817. The link on the breeze 93.9. We are coming back with Guam Department of Education Superintendent John Fernandez next at 8:17.